The CDC just took down critical HIV and LGBTQ data after following Trump's executive orders. What does this mean for public health, and why is this so controversial? Let's break it down. Welcome to Mbalica, where you can get the latest updates. So, make sure you stay tuned, because big news can come at any time. The news this time was taken from CNN.com. CNN wrote the title, CDC websites, datasets taken down as agency complies with Trump executive orders. Several U.S. Centers for Disease Control and Prevention websites and datasets related to HIV, LGBTQ people, youth health behaviors and more have been removed after the agency was directed to comply with executive orders from President Donald Trump. Trump's orders require elimination of federal DAI programs and require the government to recognize two sexes, male and female. Guidance issued in a January 29 memo from the U.S. Office of Personnel Management directs agency heads to remove all outward-facing media websites, social media accounts, etc., that inculcate or promote gender ideology, by 5 p.m. Friday. A senior health official told CNN that staff were told that consequences for noncompliance could be severe. Removal of the language will take time, the official added, so the sites and information were taken down in order to comply. In the process, large swaths of data and science will be unavailable for an undetermined period, the senior health official said. Regardless of your comfort with the idea of trans people, you should be terrified that the government is purging truth and science to fit an ideology, because what's next? As of Friday afternoon, several CDC pages related to HIV were down, including the CDC's HIV Index page, testing page, datasets, national surveillance reports and causes pages. Many of the CDC's sites related to LGBTQ youth were also removed, including pages that mentioned LGBT children's risk of suicide, those focused on creating safe schools for LGBTQ youth and a page focused on health disparities among LGBTQ youth. The site for the Youth Risk Behavior Surveillance System, a long-running survey that tracks health behaviors among high school students in the United States, said, the page you're looking for was not found. A page about food safety during pregnancy called, Safer Food Choices for Pregnant People, was also removed. Also down was Atlas Plus, an interactive tool that lets users analyze CDC data on HIV, STDs, TB and viral hepatitis, and the CDC's Social Vulnerability Index, data that helps researchers and public policy leaders identify communities that are vulnerable to the effects of disasters and public health emergencies. Last week, the Trump administration directed federal health agencies, including the CDC, to pause external communications through February 1. Asked about the changes on Friday, a CDC spokesperson referred questions to the U.S. Department of Health and Human Services. All changes to the HHS website and HHS division websites are in accordance with President Trump's January 20 executive orders, defending women from gender ideology extremism and restoring biological truth to the federal government and ending radical and wasteful government DAI programs and preferencing. The Office of Personnel Management has provided initial guidance on both executive orders, and HHS and divisions are acting accordingly to execute, an HHS spokesperson said in an emailed statement. Leaders of the Infectious Diseases Society of America and the HIV Medicine Association said Friday that access to CDC information is crucial for healthcare providers. Timely, accurate information is essential for controlling infections and safeguarding health, they said in a statement. The removal of HIV and LGBTQ-related resources from the websites of the Centers for Disease Control and Prevention and other health agencies is deeply concerning and creates a dangerous gap in scientific information and data to monitor and respond to disease outbreaks. Drive. Tina Tan, president of the IDSA, and Dr. Colleen Kelly, chair of the HIVMA, said in a statement. As pages started to come down, scholars and activists on social media have encouraged others to archive CDC data. In a letter to acting HHS Secretary Drive, Dorothy Fink and acting CDC Director Dr. Susan Menares, the Association of Health Care Journalists requested that the sites be restored immediately. That's the latest update on this policy and its impact on public health data. What do you think? Share your thoughts in the comments. Don't forget to like, subscribe, and turn on the notification bell so you never miss an update. See you in the next video.